Here are some common criticisms of psychiatry. 1. Over-reliance on medication. Critics argue that psychiatry tends to rely heavily on medication as the primary treatment for mental health conditions. Some believe that this approach may overlook other important factors, such as social, psychological, and environmental influences. 2. Diagnostic labeling. The process of diagnosing mental disorders can be subjective, and critics point out that diagnostic criteria may change over time. Additionally, labeling individuals with specific disorders can stigmatize them and affect their self-perception. 3. Lack of objective biomarkers. Unlike many physical health conditions, psychiatry lacks clear objective biomarkers, such as blood tests or imaging, to confirm diagnoses. This leads to reliance on symptom-based assessments. 4. Side effects of medications. Psychiatric medications can have significant side effects, including weight gain, sexual dysfunction, and cognitive impairment. Critics argue that these risks should be carefully weighed against potential benefits. 5. Institutionalization and coercion. The history of psychiatric institutions includes instances of abuse, coercion, and involuntary commitment. Critics emphasize the need for patient autonomy and informed consent. 6. Medicalization of normal human experiences. Some argue that psychiatry pathologizes normal human emotions and behaviors. For example, sadness may be labeled as depression, and shyness as social anxiety disorder. 7. Conflict of interest. Concerns exist about financial ties between pharmaceutical companies and psychiatrists. Critics worry that this may influence treatment decisions and research. 8. Cultural bias. Diagnostic criteria and treatment guidelines may not adequately account for cultural differences. Critics highlight the need for culturally sensitive approaches. 9. Focus on symptom reduction. Psychiatry often aims to reduce symptoms rather than addressing underlying causes. Critics advocate for a more holistic approach that considers social context, trauma, and life circumstances. 10. Lack of long-term studies. Some critics argue that there is insufficient research on the long-term effects of psychiatric medications and treatments. It's important to note that while these criticisms exist, psychiatry has also made significant advancements in understanding and treating mental health conditions. As with any field, ongoing dialogue and critical evaluation are essential for improvement.